Hello, I'm Jeffrey Diones, a student of physical therapy at Mercy College, and this video will explain what therapeutic ultrasound is. Ultrasound is a common tool used by physical therapists in treatment, and many patients ask what we're looking for when we use it. I can assure you that we are not looking for a baby in your ankle. In fact, we are not looking for anything at all. The first thing I want to clear up is to distinguish between diagnostic and therapeutic ultrasound. Now, when people think of ultrasound, they often are thinking of diagnostic ultrasound. The most common example is seeing the image of a baby. And ultrasound can be used that way. It can use sound waves to bounce around the body similar to a bat using sonar and can create an image on a sonogram. In physical therapy, we use those sound waves in a different way. When we send sound waves into the body, it's with the goal of converting the waves into energy. And depending on the location and type of energy used, there are different effects. Therapeutic ultrasound is a non-invasive tool for physical therapists that can help decrease swelling, increase blood flow, or heat areas too deep for a heat pack to reach. Therapeutic ultrasound can be used in combination with therapeutic exercise and lead to a more effective treatment. The good thing about therapeutic ultrasound is that you may barely feel it, but no worries, it shouldn't hurt. And just because you're not feeling it doesn't mean it's not working. It's what's on the inside that matters. And there are two types of therapeutic ultrasound, thermal and non-thermal, which my colleague Vivian and my colleague Jackie will explain in greater detail.
So let's take a look at the first type of ultrasound called thermal or continuous ultrasound. The reason it's called thermal or continuous is because these energy waves are being continuously sent into the body to create heat. The heat from the ultrasound brings more blood to an area, which helps healing. It also helps your muscles relax and brings down the pain. Ultrasound is able to get deeper than just a heat pack, so we'll see higher temperatures in the tissue and some heating up even at the bone level, depending on where the ultrasound is used. Usually the areas we target are smaller areas like your ankle or your thumb. This is why the wand we use is so small, is so we can create a more focused spot. In addition, continuous ultrasound is more often used in pain that's been around for a longer time, think weeks or months. So let's think about somebody who would benefit from continuous pulse ultrasound. Marvin O'Malley here is a 73-year-old tennis player who hasn't been on top of his game due to arthritis of his knee, causing him pain that he feels like just won't go away. He finally decides to go to PT because he wants to know what he can do to play with less pain. His PT is proposing ultrasound as part of his treatment to promote healing in the area and to reduce pain, while they also work on strengthening exercises to help with the knee itself. For the next 8 weeks, Marvin is going to receive ultrasound to help reduce his pain while helping bring blood flow to the injured area while he works with his PT on his exercises.
So we just said that thermal means heat, right? Now we're going to talk about non-thermal ultrasound, which means no heat is used. Non-thermal ultrasound can also be called pulsed ultrasound. This just means that the machine turns on and off every few seconds so that there isn't enough time to make that heat. So non-thermal ultrasound does something you might not expect. It can actually be used to heal broken bones. When you put the ultrasound device against your skin, it creates little gas bubbles, these that you can't see. The bubbles get bigger and smaller and sometimes pop and tell the body to wake up. Blood is brought to that area and it helps to speed up healing. Let's give an example of when you might use non-thermal ultrasound. Jackie is a 28-year-old who tripped down the stairs and broke her ankle. The physical therapist asked Jackie what activity she wants to go back to doing. Jackie tells the physical therapist that she really wants to walk down the aisle for her wedding later this year. The physical therapist explains that non-thermal ultrasound may help to heal her broken ankle faster so she can walk down the aisle at her wedding. And Jackie agrees to try this during her next PT session.
So this concludes our video on therapeutic ultrasound. Thanks
for watching.